We are celebrating the 85th anniversary of the Institute of Design. As part of our anniversary, we are celebrating our past while co-creating our future. We are here today for presenting the ID Action Labs and how ID is being positioned to help organizations rethink current systems. I'm Carlos Teixeira, and I'm the director of the ID Action Labs. We will have today 3 lightning talks. We will start with Erwin and her Equitable Healthcare Action Lab. Then we will have Weslynne, Ashton, and Maura, Shea, and they will be presenting their Food Systems Action Lab. And last, I will be presenting the Sustainable Solution Action Labs. So let's get started. So Kim, please, let's start with your presentation.
Hi, I'm Kim Erwin. I'm director of the Equitable Healthcare Action Lab. The mission of the Action Lab is pretty simple. It's to help medicine fit people, all people. Why do we have a focus on equity in healthcare? I think there's substantial evidence accruing that says because some people get the treatments they need and other people don't. Because some people in some neighborhoods have access to care, they live longer and they live better than people in other neighborhoods. And because some people can find doctors and facilities that will treat them and other people cannot. And the most frequently documented difference between those 2 groups of people are their income levels, their zip codes, and their skin color. Notably, even this simple map of the disparity in life expectancy in Chicago neighborhoods really underscores that even though this is a nationwide problem, Chicago is a particularly intense concentration of it. In fact, in discussing with stakeholders across Chicago, we kept hearing, Chicago is an emergency in slow motion. The pandemic, sure, we became aware of the disparities because they unduly impacted people who already didn't have access to care and didn't actually enjoy good health. But what we also heard is people are dying from pandemics like diabetes, violence, obesity, that we just don't frame that way. And in particular, one of my favorite quotes is from Fernando de Mayo, who's at the American Medical Association, does a lot of equity-related data work. And he said, look, to make progress, we need to move from characteristics of the patient, race, gender, to characteristics of this system, racism, patriarchy, because the problem isn't the patients. The problem is the system, and the results are of an unequal system. The Equitable Healthcare Lab, therefore, seeks to build regional partnerships that are with partners who are interested in focusing on inclusive healthcare. At the moment, we have 3 partnerships that we have been working on building. Rush University we have an MOU with them and have for about 1.5 years. Our focus is on building community effective primary care. So primary care is widely understood as being essential to equity because it is the front door of a health system. And anybody who went through the pandemic and didn't have a primary care doctor realized there was no one there to take your call. So you have to be, in order to have access to medical resources, to be connected to a primary care doctor who can oversee and coordinate your care. What we've been doing with Rush and their College of Nursing is looking at a novel model of equitable, community-based primary care. What they do is actually work with community partners. Rose Mabwa up here works for the Community Builders. The Community Builders is a real estate development firm nationwide. They focus on Section 8 housing, and they take their mission-based approach to turn Section 8 housing into communities. So here, in the community we were working in on the west side of Chicago, they removed on the first floor of all their Section 8 housing buildings all the apartments, and instead they installed a daycare center, a library, a community kitchen, and a clinic. The Rush College of Nursing manages and staffs this clinic, and they did away with the 15-minute appointment. The result is a care model that is much more accessible to people, that actually responds to the issues that people have. They get the care for as long as they need it. And this is a very novel model. We're working with them to understand how to formalize and scale that model. We're working with Rosalind Franklin University. We have a huge issue in healthcare, which is that our workforce is, well, we have too small of a workforce, but also the workforce we do have is not diverse enough. And the reason that matters is because we are not giving what is called culturally competent care. We are trying to do our best. The people I work with are tremendous and amazing. But the fact of the matter is that in order to give care in a way that people can hear and trust, it should come from somebody that looks like them and somebody who has shared lived experience. So we worked with Rosalind Franklin over this summer. We were co-designing with high hardship index communities in Lake County. We worked with 3 different high schools, the high school students, their parents, their guidance counselors, and Institute of Design graduate students use these co-design sessions to create a pipeline program that starts at the high school level, because that's where it's falling off. So it's not starting at the graduate level or the undergraduate level, although those components are part of the Rosalind Franklin pipeline program. What they didn't have was the high school component. Working with those high school students, we developed a 12-component program that they are now building and will be launching in spring of 2023. University of Chicago is now one of our largest partnerships. We started with small optimization projects like trauma resuscitation in the emergency department, using human-centered design to actually optimize the care of patients coming in with acute trauma. Trauma, you've got about 5 minutes to get it right before you have significant neurological issues. And the optimization and reconfiguring of the people in the space to enable that was the summer project for one team. We also worked on streamlining patient discharge. Every healthcare system in the country has discharge problems. University of Chicago recognized this as well. And part of the 80 some odd people that the design team from the Institute of Design engaged in an 8-week effort, 80 people in 8 weeks, I wanted you to think about that, was to understand and create a structure for thinking about how to align what they call the 3 keys of discharge, sort of like the 3 keys of the nuclear code, that have to all be there in order for a patient to be discharged in an effective way. Substantially, we've begun to work with them on a significant service redesign, something that doesn't exist. It's called Hospital at Home. This is something that Medicare approved during the pandemic, and increasingly the idea is that you can take hospital quality care and deliver it in the home setting rather than making people stay in the hospital. It's not for everyone, but people do better in hospital at home programs than they do in the hospital. They don't get hospital-acquired infections, they recover faster, they're less stressed, they're less disrupted at night instead of being in a hospital bed. These benefits, we think, belong to everybody, and we have been working with the University of Chicago and over 80 community members to try and understand how to optimize this really complex service so that equity is built in from day one. Notably, these projects have led to a larger interest in the University of Chicago medical system to partnering with the Institute of Design. Our goal with them now is not these demonstration projects, it's to change how their employees work and think. The chief medical officer said, "How do I get people to behave and think differently?" And I said, "Watch what you ask for." So the Equitable Healthcare Lab then is focused on building these regional partnerships. As you can see from the examples I gave, our focus and our approach is really using cross-sector engagement and co-creating with communities and people who are going to be asked to do and get the work. We apply our people-centered strengths and our systems methodologies from design, not just to the problem, but to the organizations. Because getting the organization ready to implement is one of the biggest barriers in healthcare. It's not the big idea. It's getting anything to happen at all. So we also are trying to work with them, because healthcare is an evidence-based field, to generate evidence for new programs and policies to create wider ripple effects. Our goal, in short, is impact. Thank you very much.
Hello. How are y'all doing? To get us going, I would first like to acknowledge that we stand in the ancestral homeland of the Council of the Three Fires, the Odawa, the Ojibwe, and the Potawatomi, who stewarded this land for millennia. At the Food Systems Action Lab, we aspire to honor the stewardship of our Indigenous ancestors and the people who came. We aim to use our work to transform food systems, to repair harms that have been inflicted on Indigenous, Black, and Brown communities, and to lift up the work of these communities to nourish themselves physically and spiritually for millennia to come. I'm Weslynne Ashton. I am an associate professor with joint appointments at the Institute of Design and Stewart School of Business. My work is in the area of environmental sustainability, industry ecology, and the circular economy. At ID, I teach courses in systems design and design for a changing climate.
Good afternoon. My name is Maura Shea. I am a recent addition to the faculty here as a professor of practice, and I'm very excited to join for the opportunity to really translate my experience in leading innovation within large national nonprofit networks and translate that into coursework and to lab work, which really helps us to evolve the field of social systems design. My background in leading innovation has stemmed from the YMCA National Office and as well as Feeding America National Office. And in both instances, it was working with communities and institutions, as Kim just shared, to really shape and change the way systems are serving people in their day-to-day way. Thank you. So our vision is based around a hypothesis that when our systems are made more visible to ourselves, to the people that work and live and breathe within them, these norms that make up those systems, the incentives, the biases, the barriers, can really be scrutinized and thus improved, or actually even better, to be transformed. And so our lab is just kicking off and is really focused on building ways to help visualize these systems, their current state as well as their desired future state. As designers well know, system transformation really requires that we include really diverse functions and skills and voices in that transformation so that we can understand how these systems are functioning and we can know where and how adaptation can occur. And in this case, that cross-sector collaboration is critical, but you can see innovation is really just one element, and it is the system's recognition of itself and the players within it that we need to scrutinize. This is just one example from one project, which Weslynne will speak a little bit more about, and this is a version, a dynamic process, as you all know, of what systems mapping requires, but it's a version of visualizing a system and the many players at work in this system and the various interactions that make up their connections. Each of these parts of this map represent subsystems themselves, both their own behaviors and workflows, their processes, etc. And we are exploring how design mindsets, design tools, and practices can really support these systems to be more just, more sustainable, more equitable.
This project, we put together this map with a group of partners from across the city and county, the region, for a workshop earlier this summer that was a part of a project called Multi-Scale Recipes. Multi-Recipes and the Good Food Purchasing Program are two of the projects that we currently have going in the Food Action Lab. Both of these have received funding from the U.S. National Science Foundation, as well as private foundations such as the Builders Foundation and the Rockefeller Foundation. The Good Food Purchasing Project is focused on systems aspect of food production and food access. It aims to use the purchasing power of large institutions, so think hospitals, schools, even prisons and senior centers, who spend billions of dollars a year on purchasing food to feed the people who are members of their institutions. So we are looking at how can we leverage this large-scale purchasing power to transform local food systems to be more just and equitable. They have the opportunity to put their public spending in ways that can transform the system and influence the transition of the supply chain to really match the needs for culturally affirming food, as well as to purchase from local suppliers, particularly producers of color who have been left outside of the traditional supply chain. The Multi-Scale Recipes project is focused on food loss and food waste. So we're looking at opportunities for redesigning social and ecological and economic systems. 35% of the food that is produced in the US goes uneaten. That represents about 2% of our GDP that goes to landfills or incinerators. And it represents 14% of our greenhouse gas emissions, so our contributions to climate change. So we are working with a diverse group of actors to understand the subsystems that contribute to the food waste challenge. We look at acknowledging the good work that's already happening on the ground, both here in Chicago and across the US, related to food waste reduction, food waste repurposing, and converting and valorizing wasted food into energy and materials. In all of these lab projects, we're taking a circular view on the food system, recognizing the benefits of localization and how working with communities can help to support their initiatives and aspirations, and working with them to co-design ways to lift up and strengthen things that they're already doing from the inside out. In the Action Lab, we build tools to help understand the different types of resources that communities bring to different projects. One of these is called a multi-capital approach to innovation and sustainability. So here we look at different types of capital or resources that different stakeholders bring to projects and can build on these different types of capital. So this is one of the ways that we're thinking about how to visualize the contributions, the assets that communities bring to projects.
Thank you. One approach that I'm bringing to collaborate with Weslynne here is the asset-based community development approach that is led by its home at the ABCD Institute here in Chicago at DePaul University. The DePaul University Stein Center has been working to develop tools and methods that really enable community development to be designed from the inside out. And the recognition of the similarities and complementariness that ABCD and human-centered design has is a great opportunity for us to not only explore how community development can really take root in the ways that the Food Lab has been defined, but also to really scrutinize what human-centered design could become if it were itself also more asset-based. So part of my coursework that I've been working on this term is developing methods and tools for community development that are really informed and inspired by recognizing the assets that people and places really embody within their communities, rather than taking the more standard conventional design approach, which is more problem-oriented in a perspective, and actually that's one that designers typically take. So this asset-based approach really sees this perspective, design perspective, as more of a deficit mind. So how can we take a new perspective and explore what that can mean for methods and tools of design? So we're just embarking on this research and have been collaborating with the DePaul Center to build methods and tools and really reflect on this from co-design values.
Thank you.
I'm Carlos Teixeira again, and I'm the director of the Action Labs. But at the same time, I'm also the faculty leading the Sustainable Solution Lab, Action Lab. And so I will be presenting what the type of work that we have been doing and how we have been framing the specifics of our work and contribution through the Sustainable Solution Action Lab. For us, while human-centered design and design thinking has been the dominant approach for developing products and service innovation, they are limited when corporations need to develop innovation based on new advancement in computation, environmental constraints, and diversity requirements. So the way that we understand products and service is by positioning products and service at the intersections of multiple systems. We understand that they exist in context and they exist as the nexus of multiple systems. So that's the approach that we take on our lab. We call this the complex space of innovation. They happen at the intersections of multiple systems, at the intersection of multiple stakeholders. They also happen at multiple levels, from policy into user interaction. And they also depend and rely and are built upon multiple intelligence, human intelligence, artificial intelligence, and the combination of those multiple intelligence. So when you think about the complexity of thinking about products and service in our days, they need to be considered at that intersection. They rely on multiple intelligence. They rely on multiple levels, multiple stakeholders, and they happen at the intersection of multiple systems. And for our work, we rely on basically 3 different disciplines. We rely on all the body of work and knowledge that we have in the design field, in the understandings of systems, as well as strategy. So we think about product and service from a strategic point of view, but we take the look of them in terms of how they are positioned in systems. So some examples of work and questions and projects that we have been working on with multiple partners, multiple sponsors, and multiple timelines on those projects. One of them is considering the question of how renewable and clean energy will reshape tomorrow's communities. When you start thinking about the changes that are happening in the energy sector, not only from a production point of view, but also from a consumption point of view, and you start situating that, for example, on charging stations, and if you just take that intersection, you start wondering that, are gas stations something of the past? And if so, how real estate will start to change? We don't need that thing at the corner and intersections of highways and roads. People can charge from the parking meter in the neighborhood. The energy that is being provided in those charging stations, if they are renewable and clean and they're coming, for example, from solar panels on the roof of the houses in the neighborhood. So now houses in the neighborhood, they are small enterprise producing energy and selling in their community. So that dramatically changed the dynamics between production and consumption in multiple sectors. And EV charging stations is one of those examples that is prime for innovation. The way that we will design those charging stations will define a great deal of the future of production consumption in energy. The same thing we can talk about bike sharing. So we can go from charging stations into bike sharing and think about the intersection of different sectors. Bike sharing, when we take from the question of how might we make mobility more equitable, sustainable, and healthier. So now we don't think about bike sharing as a micro-mobility solution anymore. We have to think about equity. Who has access to that micro-mobility? Sustainable, how do we reduce the use of the polluting mobility transportation? And how we think about also micro-mobility as something directly related to wellness, to healthcare, and being able to connect the two systems. So again, we can think about bike sharing simply as another service and design as such. But when you think about as the intersection of multiple systems, multiple stakeholders, multiple levels, and multiple intelligence, then we are repositioning products and service in the context of systems. A project that I did in the past with Maura, great pleasure to do that project, we were working on how might we increase food security in a diversifying, growing senior population. One thing is to think about providing seniors with food security. And in our work, one of the things that we identified is that there is a big difference between providing food and providing a meal. This notion of the last mile of how food becomes a meal requires an entire design into that space. So we took that project and we investigated on that. So food delivery, or meal delivery, better saying, is one of those examples that is also prime for redesign. Because they rely on intelligence, they happen in multiple levels, they depend on multiple stakeholders, and they are at the intersection of multiple systems. So that's the intersections that we have been working, and I try to show examples of different industries, because they are not just industries, they are intersections that will depend on the collaboration of multiple organizations in those industries. So to conclude here, the work of our Sustainable Solution Action Lab is not only to work on those projects and be able to think about the solutions that are needed for rethinking those systems that were designed for the 20th century and now needs to be designed to the 21st century, but also providing the organizations and the leaders and the designers with the tools and methods and practice that will be required for thinking that way. So we have been experimenting, developing, and disseminating an entire new tool set and methods that combined create a new practice. A practice around design and strategy for complex space of innovation. The ones that you see here, I'm not going to go through those details, but they represent the ones that we are developing in our courses, our classes, our sponsored projects, and have been adopted and disseminated and adopted by organizations. We strongly believe that the moment that our knowledge in knowing how to design those systems can be transferred to large-scale organizations, governments, for-profit, non-for-profit organizations, they are the ones that are positioned to design those intersections. So large-scale transformation for us will come at the moment that those organizations are capable of designing those sustainable solutions. Thank you very much. This is concluding the lightning talks for now. And thank you, the panel, the presenters. And Christine, I think we have open for questions. So open for questions here from the audience to the 3 labs, or in general about the action labs? Please, I need you.
Why is it important to have an action lab initiated by the design?
So I'm going to repeat the question from the audience here. Why is it important to have the action labs or the research labs in a design school? Anyone want to do a first taken?
I think different people would have different answers to that, but here's mine. I think we need a mechanism for graduate and PhD students to work on important problems to society that allows them to work outside the semester schedule.
Just to add on what Kim's saying, I think it's critical for us to have a chance to really prototype concepts in the real world and to have students lead that work as part of their practicum, as part of their efforts, is a great opportunity for them and a learning opportunity for the many sponsors that are part of that work. So much of design is in the interactions and the negotiations between parties. And these kinds of projects give a chance for both the sponsoring organization to learn about the value of design and the students to learn about the value of their skills.
I'll add one more piece to that, and that is that true transformative change takes time, and it's hard to do that within the confines of a semester and academic year. We need to build and maintain relationships with sponsoring organizations as well as communities, right? And if we want to really support transformation within communities, we need to build trust and move at the speed of trust in relationships with community. And so the Action Lab gives us a platform to have long-lasting relationships with diverse partners and to help shift those transformations. So it's not just about the transactions of getting a project done, getting a class done, but it really is about building relationships that help shift and promote changes in society.
And I would add to that I think we all share the strong belief that design should have an authoritative voice in that space. So there are multiple disciplines saying what sustainability is, how healthcare should be, and how food systems should be designed. And it comes from all angles, from engineering, from sciences, and from strategy, from public policy. And the question is, what is the design point of view into that? How we enter that discussion having something new, different, and impactful to say and add to that discussion. So I think we need to create those spaces where the best minds and the leading experts can come together and construct an authoritative voice in design to be able to engage in those discussions and bring many of those stakeholders, communities, corporations, government leaders, to see the Institute of Design, see our labs as a center of reference or a center of excellence, where if they have questions or they are looking for new perspectives, they know that they will be able to find here. So that's one of our strong beliefs, and that's one of the things that we really want to co-construct, is this authoritative voice from a design point of view, how we're going to enter the 21st century. We have another question on the back. Great, thank you. I'm going to repeat the question. So the question is about how the Action Lab is looking for, engaging, and working with partners, but also trying to understand the different role that different partners play in the lab. Some of them might be sponsors, some might be collaborations, and how the Action Labs are going to be managing and facilitating those engagements. So probably underlying that question, there is also, are we doing anything unique on developing partnerships? When not only developing partnership, but is there anything unique on the way that we are approaching that?
So the Equitable Healthcare Lab has 3 partners and a number of other sort of different level partnerships. We've worked with the National Academy of Medicine to develop a framework for how to measure community engagement, which is increasingly seen as important, but people don't know what that really means. So you get checkbox mentality that says, well, I held a focus group. And we think that's community engagement, to a very important point that Weslynne raised earlier, which is that we can't just keep going into communities, engaging them for our agendas, and then leaving and thinking we're going to be welcomed back. We have to provide bidirectional value. And that requires an intentionality and a different set of practices that runs in parallel to the work. So that's one example. We've also done work, as I mentioned in my presentation, with the University of Chicago Medicine, Rush University, Rosalind Franklin University, and other, in smaller ways, institutions. And the goal is always to create new knowledge, to Carlos's perspective, as well as help create a demonstration of why designers should be at the table at all.
In the case of the Food Systems Action Lab, we're the youngest lab, so we have relatively new projects, but the partnerships that we have been in place for some time. So specifically, we work with the City of Chicago, Cook County, the Chicago Food Policy Action Council, a number of agencies underneath the government, so Chicago Public Schools, for example, as well as a national network of universities through the Multi-Scale Recipes program and the National Science Foundation. I would say one of the unique things that we bring to these partnerships as designers is our ability to, one, help visualize, help envision futures, bring diverse stakeholders together, and really help to create pluralistic visions and to help create space for those plural visions of multiple stakeholders, to convene and facilitate conversations and to help move the needle in terms of the actions that people are able and willing to implement because they're having these facilitated conversations. So I'd say, yeah, for us, our partnerships are relatively new, but we have the intention that these are going to continue for quite some time. They've built on past experience, and we're really looking at having deliverables, right, that we can point to and that our partners can point to and say, these are things that we have achieved.
Thanks, Weslynne. And the addition I would make here is around the roles of funders and philanthropists. In many cases, design remains mysterious to philanthropy and to many funders who are interested in increasingly in the social impact of their investments. There's nothing better with these funders than provoking an inspiring vision, but then prototyping ways to bring that to life. And so design can play a very meaningful role in navigating those relationships and the roles that philanthropists and funders and investors can play in these kinds of systems change initiatives. So that's been very exciting to bring in those relationships in much more deliberate and collaborative ways.
I would add that we also have to think about partnerships from the point of view of scale. What I mean by scale is that we can work on specific projects, being very local with a specific group of communities, partners, and focus on a very specific solution. But what is important about that is the learning that happens not only on how to design those solutions, but also how the models from those solutions can be transferable. So the idea that a project on equitable healthcare in Chicago can become a model for the nation once you start applying the same model and adapting the same model in different other contexts. So this notion of finding partners that can work locally at a certain implementation, so you have the very specifics of a project and the very complexities of something being done at the user-centered level, at the intersectional level, but at the same time thinking of how that can be replicated and at scale by many other locations and partnerships. So for us, the notion that our partnerships, we are situating ourselves very much at being able to prototype large-scale transformation. I think one of the key elements of the action labs, what they have in common, they can work in different frames, in different topics, but basically they are working at prototyping those large-scale transformations so people can see new models, new possibilities, and it's something that other partnerships can be formed and collaborations and consortiums can be built up to scale those solutions and those models. But very good question, thank you. We have time for one more question, please. So repeating the question for the online audience, the question focused on, first of all, acknowledging that the action labs are very much focused on solutions. I appreciate your observation on that. So when we talk about research, we are very solution-oriented in terms of research, and that's a unique characteristic of doing design-led type of projects and research. But the question is about thinking in terms of solutions as it relates to implementation. So what is the role of the action labs in terms of the implementation?
The projects that we are involved with have an implementation component. Maura, I'm glad you mentioned prototyping, right? Because we are prototyping solutions with our partners in projects. And in that way, we see that there's implementation along the way. So we're doing research to analyze what is, help co-create, uplift things that good practices that we see happening. Our partners are the ones who are implementing, but we're walking side by side with them to help in the learning and the prototyping, making changes to what they're doing. So this design, solution, approach, implementation is right hand in hand with what's happening with the partners. But I'd emphasize that the partners are leading, but we're working hand in hand with them to implement and prototype solutions and help scale them, right? When we get to a place where we feel comfortable that the solution is really effective.
In the Equitable Healthcare Lab, we're just now having those conversations, so I don't have a tidy answer. I will say that there is a challenge, but we're aware of it, which is that if the lab owns the development process and attempts to hand it over, it's not going to be implemented well. So part of our strategy has been to basically coach others inside the institution to do the work so that there is ownership in there. We're only a year and a half old, so believe it, healthcare moves at a slower pace than almost any other industry other than maybe education. Present company excluded. So I think, we are going to have to address that. I think what would be fantastic is for design to look to other implementation-oriented fields. I know design thinks it's implementation-oriented, but it's not necessarily got I think implementation is implied in design rather than actively cultivated. And so part of what we're looking at is adjacent fields like implementation science that do have mechanisms for structuring implementation in more conscientious or intentional ways.
I would also add that it's very important that we understand that the Action Lab is not trying to replace any other types of institutions, especially in terms of implementation. I think that there are different types of organizations that are from consulting to companies to community to nonprofit to government. All those things, they have a different role, and they all play a significant role in both the prototyping, the planning, and the implementation. What is critical for us is to have the ability of learning. So doing research and learning from those developments is one of the things that there is a gap, there is a void. Most of design projects, they are primarily funded for implementation. You go and you do implementation and you are done, the design is out of that. Research needs to come from the beginning and follow until the end. So we might have different partners for implementation and we might not even take the lead, but it's very important that we are always there to understand the implications of the decisions that were done, the results that were generated, what are the lessons learned, and be able also to codify those learnings and disseminate those learnings. Not only in terms of the design practice, but also in terms of the results and the content that we are generating. So I think that the positioning around research and learning, it's one of the major gaps that we see that exists in the entire ecosystem of innovation and knowledge creation. And design can play a significant role, and the labs can play a significant role on being part of that, but also being able to codify the learnings and disseminate the learnings. So I'm going to, I need you, one more question, please.
We all love design, so we adhere to it, and so that's great. But what is it that you're finding in your labs that designs cannot do, that you wish design could do, or designers could?
So the question is the fact that we are here in a design school and very much in the context of a design community. But, and we are talking about what design can do, but the question is about what design can't do and what we wish design could do that we are not doing now.
I think design can do everything, so that's the issue. And of course, I know that's not true, but the ability to experience something is where someone learns a new mindset, a new point of view. And design can enable that experience to happen, whether it's through simulation or through one's own interactions in the day-to-day world. But designing those experiences can be so profound. And while there are limits, of course, there's such a vast area of potential that's a lifetime and more of work to be done. I think the labs, as Carlos has pointed out, are not in late-stage implementation. That ownership does need to transition to the sponsoring organization and be taken within and treated as one's own, right? That ownership needs to be taken over fully. And so design can't be part in the same way of those latest stages, or we will have failed.
So our joke is that I'm the non-designer here, right? So we need non-designers in the room who are familiar enough with design to work in good partnership with designers. And, thinking about the sustainability projects that Carlos mentioned and looking at the clean energy transition, we need the environmental engineers who are, in the next building to work with us so that we understand the technical constraints, what's possible, right? Because I think one of the jokes about designers, right, is that you guys come with all of these great pie-in-the-sky ideas and things that can't really be implemented, right? You have these great future visions. And that partnership with the engineers is really critical to say, okay, well, what's possible now? What might be possible in the future. So designers help to, get the engineers out of their now and their constraint mindset. But those constraints can also help frame what is possible in the near term and help to push them to see what might be possible in the longer term. So I think we do need partnerships with other disciplines to really help the work of design. And I think the Action Lab is a great platform for us to have those engagements with different disciplines.
I think this summarizes what is position of the Action Labs, which is to be able to explore what is possible, not only in terms of ideas and solutions, but also in terms of what design can do. This is a question that requires a group of people in large communities to come together and work together on that. It requires funding, collaborations, projects, research, dissemination, teaching, education, training, and many other factors. And that's where the Action Lab wants to be, is a center of excellence, a center of reference that can explore that question of what is possible. And one of the core values of the Action Labs is to advance the practice of design given the challenges that we have today. So I'm going to conclude here and thank everyone. Thank you, the panelists and the Action Labs leaders of your presentation. And I want to invite all the audience for the event that we're going to have today at night, which is going to be Evolving the Bauhaus, the Design School of the Future. We will be discussing about the future of design education. So it's a great segue from the discussion that we're having here today, not only in terms of exploring what is possible, but also starting to think about if we are going to explore new frontiers, how design education is going to look like in the future. So we are all invited for the event today at night at 6 o'clock, and it's going to be also stream online. Thank you very much, and this concludes the event. Thank you.